Blindness is a global problem. It is really sad that among 40 million blind persons in the world, 12 million are Indians. There are another 45 million visually handicapped Indians who have lost their working vision. At least 80 to 85% of blindness is preventable with a little care, health education and treatment. Programs and appeal for eye donation. Only 7 to 8,000 cornea grafting surgery is possible every year. About 7% of blindness happens from refractive error, where proper spectacles from early life can cure the problem of amblyopia. This is a real shame for our national pride. Another 5% of population in India above 40 years of age are suffering from glaucoma and slowly progressing towards blindness. At least 50% of glaucoma cases remain undiagnosed till the end. With increasing life expectancy, the problem of glaucoma is getting more and more serious.
Dristi Pradip was established with a noble mission to offer a high quality of ophthalmic service to people of this locality suffering from eye disorders. Dristi Pradip has installed all the sight-saving equipment to detect glaucoma early enough to save vision. They are a thorough ophthalmological examination, tonometry to measure intraocular pressure either by aplanation tonometry or by tonopen, or by the most sophisticated Reichert non-contact air puff tonometer, the gold standard for glaucoma diagnosis, the 3D visual field analysis by Medmont version 6 from Australia. Recent research on glaucoma shows that visual field analysis can detect visual field loss caused by glaucoma only after 40 to 50% of nerve fibers are damaged due to glaucoma. The only technology by which glaucoma can be diagnosed earlier is by retinal nerve fiber analysis, done by scanning laser polarimetry using monochromatic or polarized laser beam. This machine is very expensive. For the first time in Eastern India and in Kolkata, Dristi Pradip has installed the GDX VCC scanning laser polarimetry with variable corneal compensation from Laser Diagnostic Technologies of the USA. This non-invasive technique measures retinal nerve fiber layer and provides diagnostic information up to 2 to 6 years before any other technology can diagnose glaucoma.
Preoperative investigations. Apart from a thorough ophthalmological examination, certain preoperative laboratory tests and examinations are essential. One is the biometry test. Here the corneal curvature of the patient is measured by a keratometer, and then with an ultrasound A-scan machine, the anteroposterior length of the eye is calculated. From the above two measurements, a computer-generated printout from the biometry machine gives the intraocular lens power of the artificial lens to be implanted during cataract surgery. We have two very sophisticated machines for accurate biometry testing. The second most important preoperative checkup is the permission to undergo surgery from your family physician, who knows your state of health better than anybody else. You must have your blood pressure, general checkup and ECG assessed and decide whether the presence of a cardiologist and cardiac monitoring During your surgery, sugar, urea and creatinine, urine analysis and eye swab culture is also done as a routine.
Methods of cataract surgery. Surgery under a powerful surgical microscope is called microsurgery. A good operating microscope helps the surgeon to see clearly the delicate structures within the eye,
and closure of wound without any suture.
Conventional IOL surgery, that is, extracapsular cataract extraction with intraocular lens implantation, was an earlier form of cataract surgery. Its membrane may require removal by YAG laser or by operation. Energy as low as 0.5 millijoule per pulse, which causes least trauma to. Along with traditional autoclave and hot air oven, we have Statin 2000 of the USA, a fully computerized, fast sterilization system to back up all surgical cases. We have also installed BRM Prime CID OT air sterilizer in our nursing home recently. It filters air through HEPA filters to remove microorganisms and particles up to the size of 3 microns. The submicroscopic particles and microorganisms are then removed and killed by the electrostatic precipitator used in tandem with radiation from the twin-tube UV germicidal lamps. Virtually 100% sterile atmosphere in the operation theatre is thus ensured. Pre- and post-operative care. Care before surgery. Cleanliness of face, eyes, mouth, nostrils, hair and scalp is very important before going in for eye surgery. Wash face with soap and water properly in the morning and remove ornaments, earrings and false teeth. Your surgeon is performing this surgery for many years and has been operating more than 30 to 40 patients every week. Please remember that you and your surgeon should cooperate with each other to get the maximum benefit of modern surgery. Dristi Pradip Eye, Micro and Phaco Surgery Center. Our state-of-the-art indoor facilities were started in memory of our dear mother, late Sunipa Sen. Born on the 4th of September 1924 at Shantiniketan, she imbibed the very best that Gurudev Rabindranath Tagore's institution stood for. Not only did she receive the blessings of Gurudev, but also his close associate, the renowned scholar, Acharya Kiti Mohan Sen Shastri, her maternal grandfather. She came in close contact with many of the great scholars and eminent personalities of the time who came to Shantiniketan and left an indelible impression in molding her outlook and her personality. She exuded an aura of peace and serenity, and abundantly showered love and affection, not only on her own children, but on all those who came in contact with her. She passed away on the 16th of August, 1992. As a humble tribute to her memory, we have taken the mission to serve the people from all walks of life in the best possible way, with cooperation and patronage, to bring some relief to those who are in danger of losing their vision, a wonderful gift of God.